Basic first aid skills everyone should learn. Having a knowledge of basic first aid skills could save someone's life or your own life. These skills are easy to learn and recall in emergency situations. Basic skills like CPR, setting a spleen, stopping bleeding in dire situations are important life skills. Perhaps the most well known and the most important first aid skill is CPR. Learning CPR is very simple, it takes about 5 minutes and it could save a life. CPR is short for cardiopulmonary resuscitation. It provides artificial ventilation that can preserve brain function, blood circulation, and breathing in a person. In an emergency situation, knowing how to perform CPR is invaluable. Hemorrhage maneuver. If someone is shocking, the hemorrhage can dislodge whatever it is that is blocking their airways to save their life or prevent potential brain damage. Typically, a person who has had their airways cut off has about 5 minutes before brain damage occurs. Set a splint. If you are far away from help and someone in your group has suffered a broken bone, you'll need to set a splint. If the injury is not set before moving the injured person, it could get worse and cause excessive pain. A splint can be set with household items or with a stick and clothing if you out on their trails or in the mountains. Stop the bleeding. When you are in a situation when someone is bleeding excessively, it's important to stop the bleeding. The injured person could be bleeding from a main artery or vein, in which case they could bleed out in 10 to 15 minutes. Stopping the bleeding could be a matter of life or death. Learning how to make a tourniquet is simple and extremely helpful. Treat a brain. There are 3 degrees of burn injuries, and treating each degree is different. First degree burns really just need topical remedies and loose gauge. Second degree burns will be blistered and a little swollen. Run it under cool water, then treat similar to a first degree burn. Third degree burns are classified by whitening of the skin, blistering, and numbness. These burns should be treated by a doctor. Spot concussion are dangerous and require medical attention. After a blow to the head, you should check for symptoms like dizziness, pupil dilation, coincidence, etc.